Okay, so I have a question for all of you watching out there. Remember all that Christmas music we've been listening to throughout this entire month? Did you notice something wrong with your hearing? Well, let's put you all to the test today. A hearing test, that is. I want to play a video for you all where it shows you if you can test the age of your ears. So take a look at this video, watch and listen very closely.
How many of the following sounds can you hear? How old are your ears? Okay, if you can hear 8,000 hertz, you're both alive and not hearing impaired. But let's keep raising the frequency. How high could you hear?
Okay, so now that you have taken our little hearing test, could you all hear all of those sounds just now? Well, if you couldn't, your next step may be to seek a professional consultation like the folks over at High Level Speech and Hearing. Joining us this morning with some healthy habits is Dr. Lana Joseph Ford. She is the founder and CEO, and she's here to break down what a hearing test looks like. Dr. J, did you enjoy your holiday?
Good morning, Malik. Of course, I enjoyed the holidays. I mean, this is my favorite time of the year. So, yes, yes, yes.
I am so glad you did. I enjoyed the holiday as well. Now, that video we just showed everyone, I found it so interesting rather. Again, there were a few frequencies I couldn't even hear, and I'm 25 years old. What were your thoughts on that video?
Sure, sure. So I gotta agree with you. I'm 33, so I also wasn't able to hear some of those sounds. And you know what? It's kind of scary, right? Very unexpected, but it's true. As we age, we tend to lose our perception or ability to perceive certain frequencies.
Very fascinating. Now, again, like I said at the top, if you are a little bit concerned that you couldn't hear some of those sounds, your next best thing may be to go and seek professional help by getting a hearing test. I want to talk about hearing tests today, Dr. J. What is involved and what can we expect in a hearing test?
Sure, Malik. So the process of taking a hearing test is relatively easy. I always like to tell my patients this is the only test that you do not have to worry about studying for. So, when you do come to our office to take a hearing test, the first step is that we'll place you in a sound booth. Once we place you in a sound booth, we'll check your inner ear, your middle ear, and of course, the way that your brain reacts to sound. We have various testing that allows us to do that. But we'll put you in that sound booth where the room is relatively quiet, very, very quiet, and we'll play certain pitches or frequencies and ask you to respond to them by simply raising your hand when you hear the noise or pushing a button. And after you do that, we'll explain all of the results of the test and determine exactly if you have normal hearing or if further testing is needed.
Very fascinating. If we have a sample results of hearing tests right here, is it normal, this results that we're seeing? You're going to see it in just a little bit right here.
Sure. And I love that we have this demonstration on here. I think this is wonderful. And shout out to your team for providing this information because let me tell you, I couldn't tell you the number of patients that tell me, Dr. J, I've never seen this test before. I don't know what this is saying. So this test that we're seeing on the screen right now is actually a test showing moderate hearing loss. If you notice, we have a red line there, that's the right ear, the red line with the circles, and then the black line with the X's represent the left ear. Both are not normal. Those ears have similar hearing, but both degrees of hearing loss are not normal. They're actually moderate. So what we want to see for normal hearing sensitivity is actually what you're seeing there, where it says normal hearing ability above the 20 decibel line. That's where normal hearing sensitivity occurs.
Now, I see again the red line and the black line. Are they supposed to be more connected, or
That's
is
a great
it
question.
normal to see one ear hearing a little bit better than the other?
So that's an excellent question, Malik, because what's most important is that if you do have hearing loss, we consider it to be something that we can treat as long as the hearing loss is reflective as long as the ears match. So when we start to see that there's a significant difference between ears, that's when we'll send you to the ear, nose, and throat physician to determine if there's a serious issue involved. Because sometimes it can indicate further pathologies, such as we have patients that have tumors in the auditory nerve. And that tumor would actually be detected by a significant variation of the degrees of hearing loss. So when we see those things, we immediately refer them over to the ear, nose, and throat doctor. That is not me. So we'll send our patients there, and the ENT will be able to further assist them with determining what's causing that.
This is very fascinating. I always joke sometimes and tell my producers that I sometimes have hearing loss. But we're out of time. I can't hear you. I can take an extra minute for sure. But before we go, Dr. J, I want to ask about age. Is it normal for us to get tested at 25, 33, or you really aren't testing people until maybe age 65?
Of course. So we need to get our hearing tested annually, regardless of what age you are. I cannot say that enough. And people are still not coming to see us every year. So please get your hearing checked annually. As you age, your hearing changes. You need to know what your hearing is.
And we're coming up on New Year. 2021 is right around the corner. Treat yourself to a hearing test. Dr. J, thank you so much for joining us this morning and Happy New Year, my friend. Do not forget, everyone, she has two high level speech and hearing locations, one in New Orleans on Magnolia Street, the other is in Harahan on Jefferson Highway. Now, to set up an appointment, all you have to do is call 504-345-2984 or check out this website, highlevelhearingnola.com.